The information provided on this podcast is for general informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your qualified health provider with any questions you may have. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. Reliance on any information provided here is solely at your own risk.
Welcome. This is Birth, baby. Your hosts are Sierra Morgan and Samantha Kelly. Sierra is a birth doula, hypnobirthing educator, and pediatric sleep consultant.
Samantha is a birth doula, childbirth educator, and lactation counselor. Join us as we guide you through your options for your pregnancy, birth, and postpartum journey. Thank you to our listeners for your continued support. If you enjoy our content, please be sure to like, follow, rate, and review wherever you listen to podcasts. This helps us gain visibility to other people that could benefit from listening in. Hello, everyone. Welcome to today's episode with just me and Sam, and we are going to talk about the importance of partners taking childbirth education. So, Samantha, will you start us off by why you think it's so important that partners come to, and not just childbirth ed, I mean, all of the classes, all the parent prep classes, breastfeeding, all of it?
Yeah, I think one of the big reasons that I see being one of the most important things is that it takes a lot of the fear away from the partner when they also have some of that education, knowing what to expect and what things could look like, watching the birth videos and understanding like this is what a normal birth looks like. This is what birth can look like. Learning those comfort measures. Mom isn't doing hip squeezes on herself. She needs someone else doing those things. So the partner coming in and being a part of that class and learning all of those things with you is really, really important to just make it a more enjoyable experience for them. I cannot tell you how many times I've been in a birth and I've had a dad who is just watching these things happen, watching mom go through something that is totally different than anything else that she's ever experienced. And in any other situation would be a sign of something wrong.
Right.
And be fearful because of that. Whereas when they take those classes and they get that understanding, they're like, okay, like, yes, this is a lot, but I know this is normal. You're
this
doing
is okay.
Great. Yeah. Exactly.
In hypnobirthing classes too, oftentimes people come in with a lot of anxiety. Mm-hmm. And one of the first things I talk about is how fear is education is the enemy of fear. So sometimes partners have a hard time supporting their partner through their birth experience and the things that they want when they don't understand the process. And so they might arbitrarily be like, absolutely not for something when they don't really know about it. It's just a fear response. And then once they learn through that education what it really means, are able to ask their questions and are able to get past that fear, now we can move on to a place of understanding and supporting the partner, which comes to my next point, which is being able to understand all of those things and support the partner with things like breathing techniques, hip squeezes, that sort of thing. And also making the parent or the mom or whoever, the one that's in labor, feel supported through that and like they're not alone, because it can feel like I'm doing all of the things here, like nobody can help me. And I do find that partners often not freak out, but like have a moment of, there's literally like, I can't take this from her or whoever. Yeah. I can't take this and do this for them. So
there's no protecting from here.
Yes, because a lot of the partners are the doers and the protectors, and like they take on that role. And so not being able to do that and having your hands tied a little bit, knowing a little bit of stuff that you can do to potentially help is nice, so that they can feel like they're a little bit more of an active participant, even though they can't physically do it themselves.
Yeah. I think that's a really big part of it. And then I think the other thing that both of us have a little bit alluded to is knowing what to do during labor. There's so many parts of it, knowing like, okay, when is it time to go to the hospital? What are the signs that I want to be looking for? If her water's release early, what do I need to be paying attention to there? How do I time contractions? That's a big one. A lot of people do not know how to time
with an app.
contractions with an app. Yeah,
Don't do it
please don't write
yourself.
it down.
Use an app.
Please don't write it down. Or the graph apps. I hate those so much.
I've had
Someone sent
dads
me a
use the
graph.
stopwatch on their
Yeah,
phone. I'm like, that is not going to work. That is
no.
not telling us the information we need.
No, that's just a doula thing. My brain cannot comprehend
Like, just send me the picture, the
stopwatch
screenshot.
things
No.
or graphs at 2 a.m. It's not happening.
Yeah.
Anyways, knowing how to time contractions, knowing how to do a hip squeeze and when that might be helpful and what options are really even available, whether you have a doula or not, because even if you have a doula, you're going to be laboring for some amount of time without that doula. And once your doula is there, you don't want to just sit, most people, I should say, don't want to just sit back and watch her do all of the things. You want to know what options are available. Like, we're not coming in to take over for a partner. We're coming in to help and to and to kind of enhance your role and help you to know how to do all of the things. And you're going to be better prepared for that if you've taken some sort of class beforehand.
Yeah, and sometimes partners don't even know what role they want to play throughout this process. And when you take a childbirth ed class, you might go, oh, that sounds like something I don't think I would mind doing. Or,
Yeah.
oh, I so don't want to do that. And maybe you didn't have a doula before. And maybe in the process of a childbirth ed class, you're like, oh, buckle up. We're going to need to find one of those. How do we get one of those? I realized now that I'm out of my pay grade, But also just getting comfortable with the idea of what all that entails with a doula too, so that you can decide if you actually need one of those or, if you didn't already have one. And
Yeah.
I'm going to be a little bit of a stinker here and say something. I have had some classes where I have the birthing person ask me, hey, do you think it's fine if my partner just misses them? Like maybe they just come to one because I have a 5-class series. I'm like, you know what? Will you be okay? Sure. Will you still have, I'm your doula. Like most of them, those people that have asked me that, I'm personally their doula. So like you have, me or Sam. But if they're not willing to take the time out of their schedule right now to attend these classes, what is that a predictor of her future behavior on whether or not they're going to be involved and really committed to helping you with diaper changes and to helping you with cleaning the bottle parts and to having you get a shower and they're taking care of the baby? Like, we really need to talk about some equal here and what roles we want to have in the future. And this kind of projects into parenting on what is our relationship here going to be now that we're adding another life into this and we're not just our both autonomous selves anymore. We're this team that's having to conquer this little baby. And I think that it says a lot about the commitment that we're willing to make now so that moving forward, things like breastfeeding classes, if the partner doesn't take it, I always say take it, because if you don't, you're not going to know what things were going to be helpful throughout the early breastfeeding days. And a lot of the make it or break it on whether or not you make it in breastfeeding, if you wanted to, is whether or not your partner is supportive of your breastfeeding journey. Because there's a lot that goes into that. Yeah. So if they're not taking the class and mom is exhausted afterward and hormonal and all of these things, and they're like, I'm just giving up. I just can't do this anymore. If partner had taken the class with them, they might have some little, nuggets of takeaway gold that they go, hey, remember in class when they said what, blah, blah, blah. Maybe we should try that. Or, hey, maybe let's get a lactation consultant in to help. I know I don't know much as your partner, but I know they said in class that we could get one of those and that would help. So really, 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 if you're a partner listening to this, please step up and take those classes with them. And if you're someone listening to this that has a partner that isn't sure if they're going to attend those, have them come back and listen to this episode.
Yeah, I completely agree. And I actually don't think that's being a stinker at all. I think that's how you prepare for parenthood.
Yeah.
Truly. Like they always say moms are a mother is a mother the moment she finds out she's pregnant. A dad is a dad when he meets his baby. And doing the childbirth classes and all of those classes, I think, is a part of that, meeting your baby and being prepared for meeting that baby.
Yeah, I always say, That isn't always true, of course. It's a stereotype. Of course, it's okay if mom doesn't feel connected immediately. And sometimes dads are obsessed while mom is pregnant and they're so into it. But stereotypically, that's kind of what it is. And you're right. It starts helping with that bonding process prior to baby arriving to help that transition be easier.
Yeah.
So thank y'all for listening in. We hope you got a few takeaways from this that will be helpful for you and your journey. And we will talk to you next time.
Bye.
Thank you for joining us on Birth, Baby. Thanks again to Longing for Orpheus for our music. You can look him up on Spotify. Remember to leave a review, share, and follow wherever you get your podcasts. See you next week.